Great to be with you guys today. We're going to go over the workshop about maximizing your stem cell treatment, your regenerative therapies, and our desire is that you get the best results out of the treatment that you've got in the office. So that's why we're doing these workshops. We want to encourage you to come out to these in the office because we have a great time. But for those of you who can't make it in, we're going to make sure you get this information so that you can do the most, make the most out of your healthcare. Obviously, you've been injected with mesenchymal stem cells from umbilical cord, and we want to make sure that those things know what they're doing when they go into the area that needs to be healed. So this is a cute little thing that I found talking about how the stem cell's so confused as a baby, but as it grows up, it can differentiate and become whatever we need it to be. I think a lot of the concern comes from people is their healing time. So the most questions we get asked is, how long is this going to take? So in order to answer that, we have to figure out for you how long you've had a problem. Chronic is a term that people use for conditions that they've had in the past. Chronic is actually a 3-month process. So if you have something for 12 weeks, 3 months or greater, it actually is considered to be chronic. Acute is only 72 hours. It's 3 days. Between 3 days and 3 months is called subacute, and most people's problems resolve within that subacute phase. But if something lasts for 3 months, we know that it's a chronic condition. And if it lasts for 2 years, the research shows chances are it's probably not going to go away. So our goal is to actually intervene in cases where people have been led to believe after 2 years that their problem is just going to continue to degenerate. That's the beauty of regenerative healthcare, is these procedures, these products can actually bring you back from these problems that have been talked about in the scientific literature for years, saying that you could never recover from. So we want to add 5, 10, 15, 20 years, even 30 years of quality of life back to your health. But understanding what chronic means is really important. Chronic is 3 months, and they say that for every year that you've been sick or in pain or had a problem, it takes your body 2 months to heal for every 1 year of dysfunction that you've had. So for example, if you've had 40 years of dysfunction, then it's going to take you about 8 years to recover. If you've had 20 years of dysfunction, it's going to take you about 4 years. So our expectation that we should be better in a weekend, 2 weeks, or 3 weeks sometimes is unrealistic. But we also want to maximize your body's ability to heal by using certain protocols and, first of all, understanding how to heal the cells in your body. The 4 things we address with any problem when people come into the office is dealing with the inflammation. Inflammation is going to cause a lot of pain. Stem cells are amazing. Regenerative products are amazing at healing inflammation. We want to heal the area that's hurt. So we want to heal the area of your body. For example, if it's your knee or your lungs or your shoulder or your heart, wherever it is in any health condition, we want to address that area to help it heal. When that is done, that's not the end of it. The whole body also needs to be working, functioning, and optimized in order for your body to do number 4, which is to heal up, to regenerate new healthy tissue. When you go through these 4 things, that's just getting you back to normal. Hasn't created a higher measure of health for you. It's brought you back to a normal position, which is really important to start the healing process. So this health, we want you to understand that it's a journey, that it takes time, but the more you can do to optimize it, the better off you're going to be going forward. So we know when we're dealing with the first facet of your problem, the inflammation, which for most people equals pain, that regenerative medicine is the fastest way of any healthcare modality that I've come across to deal with inflammation, to quickly help your body rid itself of inflammation or to heal the inflammation. But the second thing we have to do is to control the inflammation. And the way we do that is we start talking about how your brain controls inflammation, controls when your body gets inflamed and when it relaxes. So we want to keep your brain healthy in order so that it can send good messages to every cell and every tissue and every organ, every system in your body. Keeping your brain healthy is not necessarily the first thing you think of when you think if you have a problem in your big toe. But your brain is what controls all the feelings in your big toe, as well as the function in your big toe. And the World Health Organization says health is actually not just the absence of sickness or disease, but it's actually the optimal function of your body in a physical way, a mental way, a social way, a spiritual way. All those things combined are going to help you achieve the health that you deserve. So the tools that we use to help you optimize your regenerative therapies, there's five sections or 5 points that we make about this. And this is the way to handle any health concern, or even if you want to maintain a healthy lifestyle or get healthier, these 5 things need to be addressed. We've worked with these for 20 years. We've seen people recover amazingly, but it starts with your mindset. The way that you think is paramount. It's crucial to you getting the best results. So I know over in Europe they did a study where they put water in a glass and they would go in the morning and talk to the water to see what the effects of our words were in the physical environment. And when they talked to the water, the glass, and it sounds funny in a nice way versus cursing the water or telling it was not nice water, they did an experiment where they checked 2 glasses of water, and the one that they spoke negative words to actually started to get all opaque and it started to have problems. And the one that was spoken positively to, it stayed clear. They've done this with plants, where a plant will die if you use negative words towards it, and the plant that you talk positively to will live. So the first thing is there's power in what you say. We can tell people who come into the office and they're always talking negative. They're always talking about their pain. They're always talking about their dysfunction. Their results tend to be less than the people who come in and they don't deny that they're in pain, by no means, but they don't focus on it. They focus on getting well, being well. They talk about being well, and they're doing things actively to pursue being well. That has to do with how you're thinking, your mindset. And that's your brain controlling your body. They've also shown that epigenetics, these things that are little triggers on top of our genes, that they can be activated or deactivated by our words. So if you say things that are good, or you live a lifestyle that is good and healthy and positive, your genetic expression, how your body expresses its physical characteristics, can actually improve because you turn the negative gene expression off. And if you think negatively, you can activate those things. So your genes are not your destiny. How you approach yourself and how you think about yourself determines a lot about how your physical properties will become. So I'm telling you, 2 people can come into the office, have really close problems. They're obviously not the same bodies, but they can have really close to the same problems. And one who thinks positively will get great results, and the one who talks and thinks negatively will get subpar results. That's been my experience over 20 years. So I can't overemphasize your mindset, because you had the mindset to try this because you thought this could be something that would help heal your body. This could be something that would help give you a better quality of life. And it will. It will give you a better quality of life. But your expectation should be that you continue to participate and continue to pursue helping your body heal and regenerate and decrease inflammation and get back to a normal state, because you've become dysfunctional over time. So it's important that we all try to continue to pursue being functional. The second point is the nervous system. The nervous system is an unbelievable way physically to help your body heal. 90% of the connections to your brain are actually found in your spinal cord. They're in the spinal column along the back of the spine. And when you move your spine with proper movement, your brain will get food every day. 90% of the food that it receives comes from proper motion in your spine. So again, if you understand this, if you have the take on the mindset, you know that your brain needs food from motion in your spine, then movement does not become so tiresome and so painful, because you know that when you're moving, you're actually producing more food for your brain. So instead of being sedentary and focusing on the pain, you move around a little bit more than you normally would. If your knee is sore after a knee injection, you passively move it, you swing it back and forth. And then you get up and you slowly walk around and you move your spine. We teach spinal exercises in the office. You can do those spinal exercises every day at home. That's going to get more food to your brain, which in turn is going to help your brain heal the areas of concern that you have for your health. Chiropractors are experts in helping the brain communicate better with the body. Thankfully, now we have these regenerative products that actually help us reconnect nerves between the brain and the affected area, which is an unbelievable thing that I never thought I'd see in my practice life. But it's amazing that when we inject those regenerative products inside your body, it will actually help the brain get a better picture of what's going on in that area as far as how much dysfunction and disease is in the area. A chiropractic adjustment is the most powerful way to activate your brain, because passive activation of your brain and your nervous system fires different areas of the brain that you cannot fire just by moving on your own. They did a study in 2013 and showed they did a SPECT scan, a brain study, and they found that when they adjusted people, their brains lit up in areas that they could not otherwise light up by doing exercise activity. The things that they thought connected to the brain, the only thing that happened was an adjustment that changed how the brain fired. And that would heal different cells, tissues, and organs, systems in your body. So adjustments have very powerful overall effects because they create proper motion in your spine. So if you move around on a spine that's dysfunctional, there's abnormal motion. But if you get motion back in your spine, it creates a whole new way for your brain to receive information. You should have 3 curvatures from the side in the spine. You should have 3 curvatures that allow your spinal cord to be relaxed. And from the front to the back, you should be straight up and down. We check this with x-rays. If you haven't had an x-ray done, I think that's a really important thing of your spine, because that will help get you better results with your regenerative therapies. So we know the quickest way to regrow nerves, we used to tell people, is through chiropractic adjustments and through spinal correction, a procedure called chiropractic biophysics, where we do rehabilitation to your spine. People get into extension, compression, traction, spinal remolding. But now we can use these regenerative products to help your nerves grow back quicker. Still, the best way to keep your nerves, the most efficient, cost-effective way to keep your nerves healthy for the rest of your life, is through chiropractic care. So we highly encourage you to go back to your chiropractor if you haven't seen him in a while, or to come and see us and we'll help you get under some form of care for your spine. The third thing we talk about is your food. So we know that you get some nutrition from your food, some vitamins, some minerals, some sustenance for your body through your food. But it can already be affected if your brain is not communicating properly with your gut. They call that the second brain, your gut. It should be full of good bacteria to help you digest and extract the nutrients from your food, and to keep a balance of flora, microbiota they call it, in your gut that helps your body take the sources that you put into it and use it in the best way possible to help you heal, to help you optimize and maximize your healing. So one of the things we found that destroys this positive gut flora that could influence your nerves, your stress and anxiety in your life, your mood and your behavior is sugar. Sugar is found in foods a lot nowadays. High fructose corn syrup they use as fillers in even different products like batteries and diapers and plastics. But fillers are also put into packaged foods. So we encourage you, number one, to eat food that's more natural. We call it God food versus man-made food. That's the number one place to start. But then we want to turn you from a sugar burner requiring sugar to improve your mood or your metabolism to using fat as fuel. And the way we talk about this is you should, for 90 days per year, you should actually go on something called the advanced plan. The advanced nutrition plan is where we try to eliminate as much sugar as possible from your diet so that you can actually become a fuel burner that uses fat as fuel. This is done by repairing these receptors in your brain called leptin receptors. Leptin is a hormone, and when they die, the more insulin that is coursing throughout your body, they slowly get worn away. But they can quickly repair anywhere from 40 to 90 days. We found this hormone was discovered in the early 1990s. And we know that when we change our diet, transition to eating good, healthy foods like avocado or farm-raised eggs or organic nuts like almonds or wild-caught Alaskan or Pacific salmon, and things like red meat that's been grass-fed, you need trusted sources for these things. That's really important. We usually look to farmers markets, or when you go into the grocery store like Sprouts or Whole Foods, you can find good organic, healthy products. But there's some important questions to ask, like was this fish farm raised? Fish farms. When I was in college, I was a commercial fisherman, and we'd actually go out in the Pacific Ocean off of the coast of British Columbia and catch fish. And in the wild population, we would be processing fish in the back of the boat, and in the wild fish population, we'd get farm salmon come into our boat. And these fish, when you actually process them, when you open them up to fillet them, they stink totally because of the food that they've been eating. They escaped out of the nets at the farms, and now they're crossbreeding even with the wild fish, and we're getting some weird looking animals come into our boat. But you could tell when you processed the wild salmon, there was no smell when you were processing it, cutting it open. And when you cut open this farm salmon, it smelled like a really bad bowel movement. And it's so interesting that wild food can be really healthy for you. Grass-fed beef has one of the best ratios of omega-3 to omega-6 fatty acids in the world. I don't know that there is even a better source of omega-3 to omega-6 fatty acid ratio, but that beef has to be grass-fed. It has to only eat grass its whole life. That's what it was meant to do. If it's grain finished to fatten it up, it makes those fats become rancid. It makes them become undigestible by your body to a certain degree. And bad fats do not help your body heal. They create more inflammation. They create more prostaglandins, which is an inflammatory chemical. And you don't want that in your body. So these are good sources of food. And when you're trying to get rid of sugar for a fuel, then you want to eat still carbohydrates. You still want to eat berries, and you want to eat vegetables. You want to eat Granny Smith apples, green apples. You can eat grapefruit. You can eat citrus like lemon and lime. you can still eat all those foods, but because they have less of an insulin spike. But you want to eat a lot of vegetables. You want to avoid vegetables that are high in sugar, like carrots and beets, for a 90-day time frame, 40 to 90 days, to heal your leptin receptors. I've seen this, when people do this, help them heal chronic disease very quickly, just by eliminating sugar. So cells that feed off sugar, cancer cells, for example, have 8 times more receptors for sugar than they do for oxygen. So you're feeding, when you eat sugar from breads and pasta, processed food, you're feeding disease process in your body. So when you can get rid of those simple sugars that actually rob your body of energy, it's called an anti-nutrient. It actually forces your body to use more energy to digest it than the energy it gets back. It's a negative interaction with your body. When you can get rid of those things, you can actually create more of a healing environment for your regenerative product that you've had injected. That's really important that you focus on your nutrition. Then the fourth thing we talk about is your exercise. Now you can just go exercise. You can walk, and that's a good thing. You can run, and that's a good thing. You can swim, you can bike, but we want you to do the optimum things to get the best results. We're really interested in you getting the best results. So if we can create a higher demand for oxygen by your brain, and thus it can distribute more oxygen to the cells, then you're going to heal better. So we exercise, we call it metabolic exercise, to change how much oxygen your brain is helping to send to the rest of your body. The main idea for oxygen debt is to try to create a situation where your brain is working harder to make oxygen. So we want to do exercise that's a little more intense than our brain used to when we're creating a new demand for oxygen. So this is an example. A squat is a great whole body workout. It's something that you do every day to sit down and stand up. It's a functional movement, but there's different progressions that you can do. So obviously if you're younger and you have great mobility in your joints, you can squat right down to the floor like the middle picture. But if you're 85 years old and your knees don't bend the way they used to, then you may only be able to do the first progression. You stand straight and you do a little squat. But with this type of exercise, you want to do it quicker than you would normally do it. So a proper squat involves keeping your toes out in front of your knees, your chest up, your back straight, and you keep your head up. And then you sit down and touch a chair. But when you do this, you're going to do it as an exercise. So you're going to do it for 20 seconds. You're going to get a chair behind you, if you can, and you're going to sit down and then stand up for 20 seconds as fast as you can. A young person might be able to do it, or someone who's in shape might be able to do 30 of those in 20 seconds. And someone who is not in shape can modify it to their own body, to their own demand for oxygen for their brain, and do maybe 5 squats in 20 seconds or 6 or 7. But you're always trying to challenge your brain to a new level. You do this for 20 seconds, then you relax or you rest, and then you do it for 20 seconds again. You repeat that 4 times, and that's your one exercise for the day. Maybe you'll do anywhere from 1 to 4 exercises per day. So you would repeat that process 4 times. You do 20 seconds of exercise, 20 seconds of rest. 20 seconds of exercise, you repeat that 4 times, and that's another exercise. It could be push-ups, it could be lunges. Whole body exercises are the best. It could be walking, it could be running, it could be biking, it could be swimming. You can apply this to anything. The goal is to create a harder work situation than you normally would. So your brain requires to produce more of a need for oxygen. That's called anaerobic exercise. And if you were doing a push-up, you can modify it. If you can't get down on the ground and push up, you can go against the wall and just gently push against the wall and come closer to the wall with your chest. And you can do that for 20 seconds, a little faster than you normally would. But the number one thing is to keep good form and to make sure you're going to be safe when you're doing these things. If it's walking, then you would walk really quickly for 20 seconds. Then you would walk at your normal pace for 20 seconds. You can modify this for any exercise that you do, and it's going to create way better results for your regenerative procedure that you performed, because it's going to help your brain make more oxygen to help those cells and those tissues heal the way they're supposed to. And that's what we want for you, great results. So this is something that you can quickly incorporate today. You can start to do this. The last thing we talk about is toxicity. And when we talk about this, this is a really extensive topic. We've done half-day seminars on toxins because there's so many of them in our world. But we are going to look at 4 main ones that can easily be changed right away to help you heal and to help your regenerative therapies work the best. So the first one is water. You have to drink clean water. It should be filtered. And if possible, alkaline water is a great source. Acid is what contributes to inflammation. So if you can have an alkaline source, that's the number one thing. You should never be drinking tap water, especially in Arizona, because of all the dirt that's in there. But we also know around the world that we find, when we measure water, we find hormone replacement drugs and pain relievers, painkillers, and antidepressants have been found in the water system, in our water system. We're drinking those without even knowing it. So a filtration system is a huge part of drinking on your house, drinking good water. In the stores, they've measured an Evian brand and Fiji brand are 2 top brands that are not acidic when they're left in the plastics, because that can be toxic too. In Arizona, if it's 110 degrees outside and you leave a plastic bottle of water, all those hormones leach into the water because they're heated up so extensively. So water is the number one thing. Put it in a stainless steel container and put it in your car. Totally different scenario. So little modifications to your water are huge. The food you eat should obviously be organic, or should be pasture raised, or should be farm raised. It should be from a known source, because they're putting fillers and chemicals. They say the average American eats over 150 pounds of chemicals every year that are found in the food sources. So medications are one of the things that are actually not only ingested from prescriptions from the doctor, but they're also put in foods, like in the meat that you eat. So your bigger sources of food are the most important to change. And we would ask that if you were going to change one thing, you might have to spend a little bit more money, but that your biggest food source is your meat, that you would buy good quality meats, because that will reduce your chemical exposure tremendously. So the third thing, is your medications. We have to have a plan. You do with your doctor and you do on your own. Have a plan to get off your medications. When you were created, there was no pocket for medication. There was no lack of medication. This is something that we've incorporated into our lifestyle. But they show people who are centenarians, people who have lived over 100 years of age, the only common thread they can find is they take very little to no medication. Most of them no medication at all. So medications are something that's toxic to your body. We know that when you take a medication, it may create some effects in your body, but there also could be 30 plus side effects to that medication that affect other symptoms, other areas of your body, and create other symptoms. Sorry. And then the fourth thing is chemicals. So you look at your household cleaners, you look at the things that you use to wash in laundry, in dishwashers, the soap you use in the sink, the air fresheners, the carpet cleaners, the fire retardants that are in your furniture. All those things can be diligently looked at, and you can start just by going to the store and getting the more natural products, the things that have coconut oil bases for soaps or laundry detergents, and you can use those as a starting point. If you just try to improve 1% per day, you can do some amazing things. You don't try and change it all at once, but you do one thing at a time. And the reason this is important is because it will help decrease inflammation in your body. And we talked about addressing that. It all comes back to addressing those 4 areas: addressing the inflammation, dealing with the structure that's damaged, and then stabilizing that damaged structure by helping the whole body heal, and then allowing the body to regenerate new healthy tissue. When we reduce our toxins, the results increase tremendously. Another way to reduce your toxins is by supplementation. I'm showing you this because I find this is a great anti-inflammatory supplement. This is one we want to start stocking in the office. But this serapeptase is unbelievable for inflammation. It helps. In Germany, they use it as a blood, uh, not a blood thinner, but as a blood healer, a medication that helps break down scar tissue in the blood vessels. And they use it as a post-surgical tool to recover faster. So around the world, we know that they use other systems, other procedures to help their bodies heal in a more natural way. And this is a great supplement. This is an example. Things like curcumin are amazing for reducing inflammation. Ginger, cinnamon, the food that you eat. But these can be taken in supplements as well. Apple cider vinegar. We want to keep your inflammation down to help address the structural damage that's happened, and then we want to stabilize the structure, and then we want to regenerate new tissue. So supplementation is another way to do that. And as I said, we're going to do some more workshops about toxicity because we know this is a major factor in preventing people from getting healed. Aspartame is a huge inflammatory contributor to chronic disease as well as inflammation in the body. Those are things we can easily eliminate. So if you have any questions on this, I'd like you to get a hold of us at the office. You can email us at support@alignedlifemed.com, or you can visit our website, alignedlifemed.com. And our heart, our goal, our mission is to help as many people as possible get the most out of these treatments that they've gotten with the regenerative products. And so we've been located primarily in Tempe, but in July, the beginning of July, we're going to be moving to Scottsdale to help serve more people in the valley. And then we're going to be moving to Gilbert to be closer to you, to help you have access to these workshops and these treatments. And January, we want to move to Chandler, and then West Phoenix in probably the summer of 2020. So understand that I've relocated my family down here to help you guys, to do my best to help you attain health, to help you and your family get healthy, to help you and your family and your friends get healthy. So we appreciate you trusting us with your health, and we want to do all that we can. We want to invest as much as we can, giving you the right information, helping you understand the most what you can do to help yourself, and also having the right locations for you to come and visit us. So we moved